Welcome to our Crack the Wellness Code Happy Senior program. Today's talk is about the dental health and the seniors. So the objectives for the program are what are the common dental concerns from the seniors perspective, generic tips for the overall oral care and the health. Also dentistry in sleep apnea and then TMJ, when to also seek help for dental conditions. Anything specific which we should know from the dentistry perspective in the pandemic and the post-pandemic time now. Any common myths which might be there for the overall wellness and the overall tips and takeaways from the program. Our faculty is Dr. Pareek, who is very established teacher and academician. So we are very happy to have him in the program. So something about our faculty, Dr. Pareek. So he has multiple specialties in sleep apnea, orofacial pain and oral medicine, and temporomandibular joint disorder. So he is a graduate of Ostrow School of Dentistry of University of Southern California, Los Angeles, and at Still University of Health Sciences in Kirksville. He completed his basic general dentistry education from prestigious dental college in India. Now, Dr. Pareek currently serves as clinical assistant professor at the Dugoni School of Dentistry at University of Pacific in San Francisco. And he has practiced general dentistry for almost a decade in India and also has completed a fellowship in oral surgery in London, in UK. So I would like to invite our faculty now, Dr. Pareek, to come and share some insights about today's evening. So Dr. Khan.
Good evening, everyone. Thank you, Dr. Sachin and Crack the Wellness Code for inviting me here for our seniors and just to provide a education about the dental issues and TMJ and the sleep disorders, oral health education for senior adults. As Dr. Sachin already introduced me, I'm currently part of the Dugoni School of Dentistry in San Francisco. My specialty is orofacial pain and oral medicine, temporomandibular joint, and sleep disorders as well. Why our smile is so important. Smile gives us a value, big value. So share the smile. A smile is the light in your window that tells others that there is a caring, sharing person inside and it's free. So saving senior smiles is very important. And life is short, but a smile takes barely a second. There's no cost for smiling. So there's a saying, keep smiling. Every tear has a smile behind it. Healthy smiles for life. A good neighbor is a fellow who smiles at you over the back fence but doesn't climb over it. Again, there's a saying, a good neighbor is smiling. Smile. If a neighbor is frowning, nobody is going to speak to that neighbor. But if a neighbor is smiling, it's an indication that they want to be your friend. Smile not because it costs you or not because you can make someone smile and make their day. So smile, please. So why our smile is so important? The benefits of good oral health includes economic, social, psychological, and physical health. And chronic health conditions create a massive burden on the health of seniors as well as the entire healthcare system. So it is very important to have a routine and regular dental care for seniors. Not only it prevents the periodontal diseases, we call it periodontal disease, back home we call periodontal disease, but also helps to satisfy patients who are at significant risk for more serious systemic conditions. So there is a correlation between oral health and systemic conditions as well. A smile is the light in your window that tells others that there is a caring, sharing person inside. So it has been estimated that 75% of seniors will enter long-term care facilities with a majority of their natural teeth. So it gives an indication that more and more people are will be having their natural teeth. It is well understood that patients with good oral care require fewer healthcare dollar expenditures, and the systemic conditions that are impacted either coincidentally or casually by oral conditions are atherosclerotic diseases, pulmonary disease, diabetes, osteoporosis, and kidney disease. The health of the mouth, teeth, and gums is important to overall health of the body. And a clean, mouth is a gateway of entry. So everything is entering from the mouth. So if the mouth is clean, a clean, healthy mouth can contribute to wellness and better quality of life. So what are the issues related to oral health and hygiene? Diabetes, blood sugar regulation, daily plaque control, brushing and flossing, denture care, cancer and tobacco use, visit a dentist for head and neck screening. Risk factors, what are the risk factors? Age, tobacco use, alcohol use. So what are the issues related to oral health and hygiene? Arthritis that affects dexterity and strength. Say in seniors, they have arthritis, say if they have arthritis in their hands, that affects their dexterity and strength to brush. So if they cannot hold the brush and cannot clean their teeth, that definitely affects their oral health and oral hygiene. So if they have a dexterity issue, use a toothbrush with a thicker handle, attach handle, duct tape or something in a rubber ball to handle. Use a electric or powered toothbrush. Or there are floss holders. If they cannot use the regular floss, there are floss holders as well. Um, what are the other age-related issues? Some medication seniors taking has a side effects such as altered taste, dry mouth. So if those are the issues, stay hydrated with water. There is a mouthwash called as biotin, biotin toothpaste, and there are rinses. And again, stay away from sugary drinks, alcohol, and sugar plus a lot of sugary drink. And since side effect of the drugs, dry mouth, it causes more cavities. Again, nutrition, crunchy vegetables and fruits like carrots and apples are great snacks. One more time again, don't eat sugary snacks or drinks, especially between meals. Why? Especially in between meals. Look, saliva works as lubricant and it has a cleansing action. So if you are having a sugary snack just with your regular lunch or dinner with regular meal, is still okay. But in between meals, because a lot of saliva flow during the lunch or dinner main meal. So should be fine, but not in between. Whole grains, fruits and vegetables, lean meat, fish, poultry, and beans. And again, try to limit fried foods and processed foods, soft drinks and juices. Most commonly in seniors, osteoporosis is very common. What is correlation between osteoporosis and oral health? Osteoporosis is an imbalance between bone loss and formation that results in decreased bone mineral density. And since it's a decreased bone mineral density and decreased bone density in the jawbone, the mandible jawbone, it leads to greater alveolar bone resorption. The alveolar bone is the bone where the denture is resting. Alveolar bone, we call it alveolar bone, is the bone of environment. Means if there are teeth, the bone is there. As soon as the teeth starts coming, if extraction, the bone starts dissolving. So if a person in senior age, if they have decreased bone density, there is a greater alveolar bone resorption, increasing the depth and number of gingival pockets, which in turn allows invasion by periodontal pathogens. So somebody has pyria or deeper gingival pockets that has more bacterial pathogens, and that leads to local and systemic increase in interleukin 1, which is a known predictor of bone loss. Correlation between periodontal disease and osteoporosis. Osteoporosis and tooth loss are health concerns that affect many older men and women. And osteoporosis is associated with several risk factors, and increasing evidence suggests that it may be associated with the reduced jawbone density, tooth loss, inability to create functional dentures. Since if somebody doesn't have a good foundation there, I mean to say the alveolar ridge there, there's difficulty to create functional dentures. And again, there are temporomandibular, the jaw joint disorders, and women with osteoporosis are 3 times more likely to experience tooth loss than those who do not have the disease. Systemic loss of bone density in osteoporosis, including that of the oral cavity, may provide a host system that is increasingly susceptible to infectious destruction of periodontal disease. So here's the thing, we can see on the left side, that's the normal jaw. And on the right side, we see osteonecrotic lesion. We can see the thinning of the bone there. Again, osteoporosis and oral health, bone loss in the jaw and around the teeth. We can see here bone loss in this area, tooth loss, loose or ill-fitting dentures, gum disease. Here is the radiograph. In the radiograph, you can see that there's a generalized bone loss around the teeth. See, there is no healthy bone around here. So this is a general, I have given a general description, aging, and what could be the issues with aging and dental diseases. And as Dr. Sachin mentioned, this is the disclaimer that this is a general education program, and all the information provided is for education purpose. So I will, from this information, I will open, Dr. Sachin, is it a good time to open for the question and answers?
Yeah, absolutely. We have a question from somebody. It says senior citizens who are not under medical but under covered California, how can they get dental treatment or dentures? Any ideas for them?
So I believe in covered California, I believe they have their own panel where there are dentists, and I think if they contact to those dentists in their panel, and if it is covered, I believe they can get dentures from there. I'm not sure whether the dentures are covered there or not, but I will definitely find a exact correct answer for this question and will share with Dr. Sachin as well.
All right. Are there any other programs for the seniors in your university school where you teach, or any resources?
Right. Yeah. So most of the time the schools have a different system where, where it's a bifold benefit kind of thing, where the students are learning how to make dentures, and on the other side, the schools provide discounted rates for the dentures. So if they contact the schools, and on top of that, when the students making the dentures, there's another benefit that they go with exact the steps. The steps should be taken to make dentures. Sometimes we go to the dentist and definitely, dentist sending it to labs and the labs preparing, but then the schools, the students learn the exact steps, and in so many steps, the patients can see the steps also, and I think it's a very systematic way and very discounted way. So they can contact the school, and I can share the details with Dr. Sachin where they can contact. But there are, on top of that, there are other non-profit organizations in San Francisco Bay Area. There they provide discounted dentures as well. And I will share that information maybe in the next webinar or with Dr. Sachin, definitely.
Thank you. So you also mentioned some really interesting points based on the one thing was the osteoporosis and its effect on the overall the dental health, and then also the TMJ. So maybe would you like to share some more insight, like maybe some common tips for seniors, either identifying what might be the risk factors, and then you kind of shared into the presentation.
Definitely.
But and then maybe what are the red flags? When should somebody really look into seeking help for those?
Sure. So the most common myth, of what I have seen, where our seniors, especially seniors, they are wearing the denture and they are leaving the denture in their mouth in the night
Right.
while sleeping. So is something, say, we cannot sleep while wearing our shoes or sleepers in the bed, right? Something like that. If we are wearing the denture has to be taken out in the mouth in the night and should be kept in water or somewhere. So otherwise, if the denture is in the mouth, there are two issues. There's a possibility of a fungus called a candida growing, or if the foundation, the alveolar bone is not getting rest, then there is a possibility of other issues there, infection or other issues. And as you asked about the TMJ and the degenerative diseases, as we age, people have definitely now seniors have a common issue of osteoarthritis, and the osteoarthritis can cause osteoarthritis of TMJ as well, and they can have a crepitation kind of a creepy kind of sound in the jaw. So at that time, we suggest don't open your mouth a really wide, and if somebody has have difficulty in opening or any other issues with TMJ, they should consult their uh, dentist or the specialist in TMJ.
There is another question. I can't really understand it, but hopefully it means if there is on or off sensation, what is the cause? Mainly where you have metal crown, it says. Oh, so
Right.
it says if you have a metal crown and if you have strange sensation, um, what might be the reason for it? Somebody is asking.
Sure. So, again, if somebody has a metal crown, nowadays, most of the time we are going with ceramic crowns, but if somebody has a metal crown, metal is a conductor. Metal is a conductor of hot and cold. So definitely, if somebody has a metal crown, metal are good conductor, and there could be a possibility of having sensation. On top of that, if a person has two dissimilar metals, on one side a different metal crown and other side a different metal crown, saliva works as a another conductor, and their dissimilar metals can cause we call it a galvanic current, and there's a possibility of that kind of sensation as well. So metal is a reason of sensation, and if somebody has having a metal crown, they need to have definitely a regular dental checkup. So making sure the tooth inside where the crown is healthy. There's no decay. There's a possibility of decay, and the decay might be causing issues, sensations. So a regular dental checkup is very important.
Thank you. So now for daily hygiene, you mentioned something about the specific type of electric toothbrush and things. So what will you recommend people with dentures, without dentures, either way, and maybe some brushing tips? So what might be the good brushing tips?
Sure. So I will start with the denture. That is the denture should be cleaned. Yes, the denture should be cleaned. Denture should be cleaned as we are cleaning our regular teeth. So denture should be cleaned from outside and inside as well. There's possibility of food going inside and sticking inside. So in the night, take the denture out, clean it, put in the water or the container, whichever container your dentist has given. And people who has dexterity issues, who has arthritis in hands or something, they cannot hold the toothbrushes. So there are toothbrushes with the bigger handles or electric toothbrushes. So they can buy, from regular, Walgreens or the regular pharmacy, and they should use regular electric toothbrushes. So this shouldn't be an excuse that I cannot hold the brush, a regular brush, or some other issue, and that's the reason I'm missing my regular brushing. So brushing is both 2 times, morning and bedtime brushing is important. And if you have enough teeth in your mouth, I think you should floss as well. So flossing, why flossing is important? So flossing takes away the food in between, interproximally in between the teeth. So that is very important.
And if somebody is using the flexi tips, those cleaners,
Yes,
in
right.
versus the flossing, are they both necessary or just one is enough?
Interdental, we call it
Yeah.
interdental. So they can do, if they can hold floss in their hand and floss, that should be fine. And if there's a dexterity issue, they cannot hold the floss, then the floss holder or those kind of floss should be used with the floss holder.
Okay. There is one more interesting question: is how to know you have cavities?
How to know cavity? Yeah, yeah, I mean, it's again, it's a common myth. Most of the time, people are not approaching to a dentist unless there's a pain in the tooth, right?
Yeah.
So, say if you see a black spot in the mouth, I think you should consult your dentist. Or if you are feeling either hot or cold sensations in a particular tooth or sweet sensations, I think that's the time you should consult a dentist. I mean, the best thing is every 6 months regular checkups is the best thing. But again, that is a warning sign kind of, right? Yeah.
All right. Somebody was asking about how to know your bone density. Do you have any specific things for it?
Right. I think the bone density, when you are going to your yearly medical checkup, at that time, that's the medical part. So you can request your check with your medical doctor. Uh, that it is time to check the bone density. They are the best people to let you know.
So now, because you have the big background into sleep apnea, so maybe will you give us more insights about the apnea and then its relevance to the dental
Sure.
part? Yeah.
Definitely. So where the dentist role is coming, especially the sleep specialist dentist role coming, uh, when the patient is not able to tolerate the CPAP or BiPAP, and where the tongue, when it's diagnosed by the medical doctor or by their physician, that the tongue is falling back in the night, and narrowing the space, breathing space. So at that time, there is the sleep dentists or sleep apnea specialist dentists. They are making dental devices. We call it as dental devices, sleep dental devices, and there are very good devices nowadays. Um, there is one good device we call mandibular advancement (MAD), mandibular advancement device. There are devices which are holding the tongue in place in the night, so that way the tongue is not falling back and blocking the narrowing the space. And there are, other than that, there are so many newer good appliances are coming in the market. So um, again, talk to your physician that if you are not able to tolerate CPAP or other modalities your physician is suggesting, and have an appointment with your sleep dentist, sleep specialist dentist, and your sleep physician and the dentist, they can work together and can find a good suitable appliance for you.
Yeah, because I believe that most people are not that well aware of the dentistry role into the sleep apnea. Means everybody knows apnea, but
Correct.
the relationship. So thank you for sharing that. There is one more question came which says, do you have any idea on prevention of bone loss, especially into the jaw bones?
Yeah, the basic best idea is, as I mentioned, alveolar bone. The alveolar bone is the bone where the denture is resting. Alveolar bone is the bone of the environment. Having said that, more and more healthy natural teeth in your mouth is preserving your bone if you don't have any other medical issues. That is such as any disease which is causing osteoporosis. So maintaining your healthy teeth is the best choice. As many healthy teeth you can save your teeth. So again, maintaining your oral hygiene, brushing twice, and having a regular dental checkup is the best way of doing that.
Now the things are opening up gradually and things. So a lot of people, maybe they couldn't go to dentist in the corona times. So what protocol should they follow, like to restart their checkups and visits and maybe pending work?
Sure. Yep. Yeah, most of the time, what I share with in the education programs, we wash our hands multiple times. Every time we touch a contaminated surface or something, we just wash our hands. And in our mouth, we never wash our mouth. I mean, we wash our mouth in the morning and evening. So maintain your oral hygiene. If you cannot see the dentist right away, at least, meanwhile, you can maintain your hygiene in the sense brush 2 times, floss 2 times, and intermittent snacking, sweet drinks, as I mentioned, should be controlled. I mean, you should be taking less uh, sweet drinks or, and I think as we are opening slowly, it's time that you should have your regular dental checkups at least twice a year. So meanwhile, you can maintain, and time is opening up, you should start seeing your general dentist. Now it's time, right?
Wonderful. So now anything else you would like to share with maybe their, the for dryness, like you mentioned, any other specific things people can add for just well-being, or to, even if they don't have issues, just for prevention? So you said flossing is one, or the proper follow-up and cleaning periodically, that's another. Use of the specific proper toothpaste, which can be also helpful to support it. So anything else you can recommend?
Sure. So I mean, the most important thing is don't ignore a dental problem unless you have a pain.
Right.
Don't ignore any dental issues. If you find that you are having a dental issue, immediately, you should consider contact your general dentist or your dentist, and start getting treatment for that. So I always share a example with in the dental education programs. Your our mouth, all the dentition is just like a garland. You take
Yes.
one pearl out of that, the whole garland starts losing.
Yes.
So if one tooth is out or something, the whole dentition, say they take one tooth out from top, there is no counterpart in the bottom. So the top
Bottom.
tooth, yeah, no counterpart. So the top tooth starts growing. Or there's a possibility, if there's no bottom teeth there in that area, this other teeth start drifting on in that area. So the whole garland starts loosening. So definitely taking care of every tooth is important, and every tooth has a value. The canine tooth has a value in a smile. I mean, all teeth, and you definitely need good teeth in the back, at least the molars, to have a good nutrition, especially during your senior years. If you have good teeth, you are able to chew, and you are getting good nutrition. So that is very, very important. And don't shy in case if you are without teeth. I think you should go for a denture, so at least you are able to have some mechanism where you can chew your food. Yeah.
So there is a question about what's your opinion on the role of taking calcium tablets? It won't say for what reason, it's just very generic question.
Yeah, I think from the dental perspective, I cannot comment on that. I think the physician would be the right person to answer that.
Right.
Taking a calcium supplement, but
Yeah.
having good, giving a good exercise to your teeth, like as I was mentioning in my slideshow, having carrot or the green vegetables is a good exercise to your teeth. Definitely. Yes.
Yeah. So somebody is asking, Is a saltwater gargle good for tooth? Well,
I
people
would
have
say,
very interesting questions.
I would say regular brushing is the best. Do any toothpaste, a soft toothbrush, make sure it's a soft toothbrush, you know. Uh, why soft toothbrush? You know, you hold a hard, rough toothbrush and rub on a polished surface. Anywhere you will see is the, you know, micro scratch marks there. And if you rub the same toothbrush every day on your teeth, definitely, you know. So use a soft toothbrush. Any toothpaste is fine. I usually, again, it's up to you, but I usually avoid, for myself, I avoid the whitening toothpaste. But any toothpaste is fine, but soft toothbrush, that's the best habit. Nothing other than that. Yeah.
What's your take on the tooth powders?
I mean, back home, we used to use the tooth powder, so
Yeah.
there shouldn't be any. Uh, we go by the abrasive power of the toothpaste or tooth powders. Abrasive power is the crystal size inside. So say something has a bigger crystal size or more rougher crystal size, and if you put on a polished surface, again you will see the abrasion marks there. So if the tooth powder has is fine enough or it has no bigger particles, I think it should be fine. And I think I don't see a big culture here in the US. Most of the time we are
Nobody,
using
yeah.
toothpaste
It's
out.
not very
Right,
common.
right. But you're right. Toothpaste is the best again. Yeah.
And somebody, Purnima, is asking, how can we clean our crown teeth to keep them healthy?
Crown to keep healthy.
Yeah.
Yes. So again, keeping the crown healthy is interproximal cleaning is very important. Interproximal means in between. So you have crown on this tooth, there's the adjoining tooth, and there's another tooth. So cleaning the floss, I mean, taking the floss in between and cleaning the interproximal area is very important, because if the food is stuck in there, there's a possibility of decay there. So that is the best way of keeping your crown or the area around the crown clean.
Wonderful. So another thing is, do you recommend the floss after brushing or before brushing?
After brushing, definitely. Yes. So whichever is left after brushing, you can take it. Most of the time, the brush is not going in between teeth interproximally. So the floss is playing that role and and cleaning that part, that area. And there are water flossers as well nowadays, and a lot of other devices. A
Yes.
regular floss is doing the job, but again, I said individual choice, or if their dentist is suggesting for a water floss or something else,
So
they should
what
be
do you
using
think of the water floss devices?
these devices has a water flow that's cleaning in between the teeth. But I've seen the regular floss is doing the job, so should be fine. But again, if the their dentist or their healthcare specialist or advisor is suggesting a water floss, they should be going with that. Yeah.
And there are now growing trends to use the electric sonic toothbrushes. So how people should make a good choice for a good sonic toothbrush? Like what should you look for? So when you said soft, should be soft and soft bristles and things, but what are the other criteria?
Right. So other than criteria, the speed, RPM, revolution per minute, and again, there are different kind of handles, and uh, what is the need of electric toothbrush? You know, sometimes we are holding the brush and, you know, end of the day, you are holding the brush and, you know, you are ready to sleep, and you say here, there, and boom, boom, I have to
Yeah.
sleep. So if there's electric brush is doing the, you know, that rotation work, cleaning work, I mean, right.
Yeah.
So that is the importance of the electric brush, number one. Number two, the revolution per minute. There are different variety of toothbrushes with different kind of bristles as well. So, you know, it's independent choice, individual choice, I would say. Any electric toothbrush which is economic should be fine, unless something is suggested by your dentist where they're saying, oh, your teeth are more sensitive, or you have some abrasion or like hypersensitivity issue or something, then you should be using a particular one. Otherwise, a regular electric toothbrush should be fine with the soft bristles.
Now, that's wonderful. So now, what you will give us as a final takeaway points overall?
my primary takeaway I will be coming, as I have mentioned multiple times, as we wash in a COVID time, we were washing every time, we were saying wash your hands for 2 minutes, at least 2 minutes, right? The same way, clean your, it's a gateway of entry. You clean your mouth. The bacteria, mouth is the best incubator. The temperature inside the mouth and the multiple bacteria in the mouth is the place where, so if you keep it clean, you help me keep my mouth clean, I help you back, something like that. So clean your mouth, at least brush 2 times a day, morning and bedtime, and floss. That's the best habit. And again, on top of that, see your dentist at least twice a year, if possible.
Twice a year.
Yeah, that's a takeaway point.
All right. Thank you.
And do not ignore any small dental issue at all.
Right. What do you think of oil pulling? That's very popular trend nowadays, the Ayurvedic protocol.
Yes. I mean, back home, I have seen, they were mixing, I think, salt with mustard oil, ka sarson ka tel ke saath mein namak mila ke, right? I've not seen that practice here, and I am not sure any information about that.
But there is no harm from your perspective.
I cannot advise anything about that. Yeah, but I've seen back home using the oil mixed with salt or something. Yes.
Yeah, because it's now getting quite popular here also.
Okay, I think in Ayurveda, all right. Yes.
And one more question came from Pratima. She is asking how often one should change their toothbrush, or maybe we can say if they have electric toothbrush, the brush heads.
Right. When ideally, you should be changing your brush in 90 days, 3 months, 90 days. But again, it's a choice. When you see the bristles starts, if you see the bristles starts, rolling, or bristles starts getting bad, I think it's time that you should be changing the toothbrush. Around like 90 days, right? Yeah.
Excellent. So that's how we will conclude today's evening program. So thank you everyone again, and then we will see you soon. So bye and good evening.